Thank you very much. I will go to Senator Roberts.
Thank you, Chair. I've got several issues here that I'd like to discuss. National Blood Authority about tainted blood, the pelvic mesh, the Lyme disease, ATAGI, following on from Professor Lawler's comments. So I'll start with National Blood Authority, please. And is Dr. John Rowell here? Dr. John Rowell? No?
Senator Adriana Platona, Chief Executive, National Blood Authority.
What's your second name, I'm sorry?
Adriana Platona.
Thank you. Okay. A lot of people are plagued with tainted blood, heavy burden. At CSL's 2024 Annual General Meeting, Chair Brian McNamee stated that prior to its privatisation, the Australian Government was the owner, funder and regulator of the Commonwealth Serum Laboratories. Is that correct?
Senator, the National Blood Authority was formed in 2003 as a statutory legislated agency. I'm very happy to answer questions about the National Blood Authority role and work since 2003.
Yeah, I'm just wanting to know if you could confirm that before the Commonwealth Serum Laboratories was sold off to the public, it was an Australian government was the owner, funder and regulator of the Commonwealth Serum Laboratories.
I believe that is correct, sir.
Thank you. What steps did the Australian government take to regulate the safety of the Factor VIII and IX concentrates manufactured by the Commonwealth Serum Laboratories in the 70s, 80s and 90s?
Senator, as I said in my question, in the first statement, the National Blood Authority was formed in 2003. I'm happy to answer questions about the work of the agency since then. You are referring to matters that precede the formation of the National Blood Authority by several decades.
Could you tell me, and I know it was a long time ago, but a lot of people are suffering now, severely. Whose responsibility was it at the time, Ms. Platona, is it Professor?
Yeah. Ms. Platona is fine.
Ms. Platona, to ensure the safety of the Factor VIII and IX concentrates?
So,
because this has relevance to what you're doing now.
Indeed. So, the National Blood Authority was formed, as I said, as a result of a number of circumstances that some negatively affected people in the 70s, 80s and 90s. My predecessor provided in November 2024, in response to your question on Hansard, a lot of context to the steps that have led to the formation of the National Blood Authority, the apology that, and the formation of what it is now, a National Red Cross Lifeblood organization, the apology that Red Cross Lifeblood made in 2014, a number of actions by states and territories government to deal with really the failings of the blood transfusion in the past. And I do not want you to think at all that I don't think about the lives of the people that Haemophilia Foundation, for example, is working to support. Not at all. I'm the officer that has got the Public Service Medal for making the direct antiviral medicines available, those hepatitis C treatments that are now considered to be best practice and curative. So I do want to acknowledge the hard circumstances of the people affected by the disease.
That's good. That's good. Do you want to say any more on that?
I'm keen to do a good job, Senator.
Okay. How can you do a good job for people with tainted blood? Because it was the government's responsibility.
So, Senator, since the organization was formed in 2003 to date, there is no contaminated blood incident.
Do you not have any legacy responsibilities from your predecessors? The Commonwealth Government is responsible.
So, Senator, prior to 1991, the Commonwealth's role was largely through providing funding to state and territory governments to operate blood services. States and territories regulated the blood supply system in Australia until, as Ms Platona has explained, the National Blood Authority was established in 2003 and provides that now national coordination. I think we also had the Therapeutic Goods Act 1989. After that there were changes to the way that blood was regulated as well. But before that, largely the regulation would have been occurring through state and territory governments.
But it was overseen by the Commonwealth. Well, let's go through the history. Correct me if I'm wrong, Ms Shakespeare. In March 1953, the World Health Organization released a report that recommended dried plasma should be prepared from small pools of no more than 10 to 20 donors. This was ignored, and by the mid-1980s, factor concentrates were being manufactured using mass pooled plasma from thousands of donors, significantly increasing the risk of hepatitis and HIV. Why were these early recommendations ignored? Now, you weren't around then, but that was federal responsibility?
Senator, we can try and take on notice what if there's anything in the archives about what happened in the 1950s, but it is a little bit difficult for us to talk to you about what happened at that time.
Okay, if you could take these on notice then, please. In the mid-1980s, actually it was, factor concentrates were being manufactured using mass-pooled plasma from thousands of donors, which went against the prevailing wisdom. Could you find out, Ms Shakespeare, and I thank you for your attention, was it considered an acceptable risk that there was a high probability of haemophiliacs using factor concentrates that would be infected with hepatitis non-A, non-B, Hep C in the 70s, 80s and 90s?
So, Senator, what I can tell you is that the first specific test for hepatitis C became available in late 1989. Australia was one of the first countries to commence using the test in November 1989, with implementation completed by February 1990. Similarly, we were one of the first countries to introduce HIV patient screening in May 1985, when tests had become available to make sure that the blood supply was safe and could be monitored for those particular medical issues. We've implemented that as early as possible.
I'm wondering how to help these people.
So I think Ms Platona has spoken about some of the assistance that has been provided, and I can go through some of the help that has been provided. So first of all, there was a review of the blood arrangements in 2001 that was conducted by a former High Court judge. The recommendations from that review were provided to all Australian health ministers and led to the establishment of the National Blood Authority and the centralised, coordinated arrangements we have to ensure a safe and adequate blood supply that we still have today.
So let me
we have haemovigilance.
Can I interrupt you, sir?
Of course.
So that would assume that prior to that it wasn't considered to be safe, the blood.
So decisions will have been made based on the state and territory government's delivery of blood products, about the introduction of testing when it became available, when those tests were developed. And as I said, compared to other countries, Australia was one of the first adopters and introduced those tests at a very early stage. But we didn't just stop there. We've been, establishing arrangements to make sure that the blood products that we provide to people today are nationally coordinated, and that we've got consistent arrangements, and that we don't have differences between regulation and provision in different states and territories. The National Haemovigilance Program for Australia has been developed. That's a set of surveillance procedures covering the entire blood transfusion chain, from donation and processing of blood to their provision and transfusion to patients. We have monitoring, reporting, investigating the analysis of adverse events related to donation, processing and transfusion, and development and implementation of recommendations to prevent the occurrence or reoccurrence of adverse events. So we've got a whole haemovigilance program that now operates. That's been developed and implemented through the national blood arrangements. For people that have acquired hepatitis C, the direct-acting antivirals, which were listed on the PBS in 2016, and at that time was the largest single PBS listing that had ever been made. We have future generation direct antivirals that are now provided through the PBS, and if I can give an example, in 2023-24 we had 9,167 scripts of a drug called gleparopivir and pibrentasavir, which is a current generation treatment for hepatitis C at a cost to government of $161 million. In the same year, sofosbuvir and velpatasvir, another medicine to treat people with hepatitis C, 10,953 scripts at a cost to government of $131 million. So we're providing access to those treatments. Now, that covers anybody with hepatitis C. It doesn't matter how they acquired it, but it would certainly benefit those who acquired it through the blood system before the testing was available.
So some of these people with tainted blood their lives have been really shot. Perhaps you could look at the camera, and I'm not trying to put pressure on you or Ms. Platona or the Minister, but what do we do for these people? Where do they go for compensation? Britain has compensated their people with tainted blood. Long ago. They've admitted it and gone on with the job. How do these people recover? How do these people get compensation if they can't? I know you've given a list of drugs. What do we do?
Those are curative, in many cases, direct-acting antivirals, which will be of significant benefit to people with hepatitis C. I should also say that the Australian Government contributes to the hepatitis C litigation settlement schemes, which were set up and are managed by the state governments for people that were infected through the blood supply system before we had the National Blood Authority established. So that offers financial settlements for people who contracted hepatitis C between 1985 and 1991. So there has been compensation made available, and the Australian Government contributes to that.
Senator Roberts, I'm going to have to share the call.
Thank you for your interest, Ms. Factory.
You're welcome.